Welcome to the Braver Angels podcast, a new way of talking politics. I'm your host, Ciaran O'Connor. My guests today are Hawk Newsome, co-founder of Black Lives Matter of Greater New York, David Awinski, a Trump supporter who helps lead Braver Angels debates, and Dr. Tess Russell, an anesthesiologist and intensive care specialist at Columbia, New York Presbyterian Hospital, which was at the epicenter of the first COVID wave in New York City. We're gathered here today for a discussion on vaccines, one of millions of discussions happening across the country as people decide whether or not to get vaccinated against COVID-19. We're not here to debate or try to persuade anyone, but to share our own perspectives, to learn from each other, and hopefully have a conversation that can be helpful to listeners across the political spectrum and across the vaccine divide. First, I'll go around and give each of you a chance to talk about your own perspective on vaccines, and then I'll give you a chance to ask questions of each other. Hawk, I'm going to start with you. And let me say up front that I know you're here to express your own views, not represent Black Lives Matter in any way. In August, you were quoted in the New York Times expressing your distrust of the COVID vaccine. The article was exploring why Black New Yorkers are disproportionately reluctant to get vaccinated. Can you talk a little bit about your position on the vaccine and perhaps talk a bit about vaccine distrust in the Black community?
Hey, what's up, brother? Thanks for having me back on. I appreciate the opportunity to just give a perspective of people who aren't really heard too often, right? I don't speak as much for the activist community as much as I speak for the just regular Black folks and how they feel, the ones I come across, the ones I grew up around, and the ones who I live amongst now. When they were introducing the vaccine in New York, the governor invited all of the Black leaders from New York City to Riverside Church for a speech or a press conference, whatever it was. Everybody signed on without seeing any data. We were the only ones who asked for data, like give us the numbers, give us the science, give us everything you have so we can make an educated decision. And they would not do that. It took them 2 to 3 months to get us the information that we wanted. So here you have politicians and Black leadership in cahoots to just force something on us without proving that it's safe, that it's effective. We all know about the Tuskegee experiments where they gave syphilis to Black people, didn't give them a cure. These things ran through 82. We also are fully aware of the fact that doctors do not listen to Black people. This is what every study says, that when Black people have complaints, especially Black women, doctors ignore them. So we experience racism in the medical field. Going back to the vaccine release here in New York, the governor was like, we're going to make sure that Black people get it first. Since when does America want to give Black people anything first, right? But I'll tell you this, I won't say I'm against the vaccine. I just don't trust the vaccine. I tell people that take the vaccine if they want to take the vaccine. But what I'm absolutely unambiguously against is the vaccine mandate. I don't think that anybody should be forced to put anything in their body. Like the government should be able to force us to tell us what we should do with our body.
And so do you think that given the history of racism in the medical establishment, do you think that's the primary driver of skepticism among the Black community, or are there other reasons that you hold and you hear from your own discussions with people in your community?
People just do not trust the government, and they do not trust pharma. We just don't. Right? We always feel as though they're trying to scam us. Black people literally feel like the government does not want us here. Okay, if you look at these food deserts that we live in, if you look at the killers of Black people in their poor health conditions, and nobody really doing anything serious to help us, right? Like, we just do not trust these people, and we shouldn't. You know, if you look at Donald Trump was just all over the place on COVID, from telling people to drink bleach or not. I don't care if he was joking. He's the president. He shouldn't make jokes like that. Every other week when COVID arrived, when it hit our country, when it hit the world, there was a different story on it, right? Then you have Joe Biden. He comes out and says, you know, we're introducing the vaccines. One, there'll never be mandates. 2, you won't get sick and get hospitalized. 3, you won't die. So he's lied to us about the top 3, I guess, components of the vaccines. So why should we trust these people?
Is there any information that you could get that you think would convince you to get the vaccine?
You know, what you said talking about is a burden of proof, right? And I don't believe that I don't know what my burden of proof would be. I wouldn't know when it would hit me, you know. I don't know. I'll know it when I see it, but I just don't trust. I just don't know what it is right now.
Gotcha. Well, David, I want to go to you next. I know you're a strong conservative and a Trump supporter, you know, who resonates with some of the arguments we've seen on the right. Can you talk a little bit about your perspective, both personally and among your political community?
I think that, first of all, it's great to hear Hawk's perspectives, because whatever positions we may have had on Trump as president, the Trump supporters these days would resonate with this distrust of government and government information. This is the one area where these two groups might be completely in alignment. A recent Monmouth poll showed about 43% of conservatives are not going to get the vaccine. A PBS NPR Marist poll showed 41%. I mean, our first concern, under the umbrella of not trusting what we're hearing, is that there are concerns about inadequate testing. Almost every drug that has gone through, I mean, many, even with tremendous years of testing and side effects, they still find things they don't catch. This one rushed into production. Secondly, the politicized nature of the CDC and Fauci. I mean, it just seems that they're following whatever is the White House narrative. What's the talking point of the day? And Fauci in particular, boy, there's so many videos of him flip-flopping. Well, masks are ridiculous. Well, now you have to wear 2, and masks are going to be taken away. You might have to wear them for the rest of your life. This, as a person speaking as an authority, undermines any credibility. What is also very troubling to conservatives is that on social media, there's a tremendous amount of suppression of anybody talking about an alternative cure. Anything that comes out that doesn't support the narrative, it gets yanked off Twitter, it gets yanked off Facebook. You're branded as a speaker or that is not reliable. So why not let the information out? And then the other thing is, if it's so good, why are there loopholes in the mandate? Why does the post office not have to do it? You think the post office comes in contact with packages and people all over the country, but it doesn't apply to them. And then you get these situations like all the folks at the Met Gala. The only time they had masks on and were doing COVID good practices is when the cameras are on. And there's no information on how many members of Congress have received the vaccine. So there's all these gaps of information. And the same people that are lecturing us about how bad we are not to take it may not be taking it themselves. The other thing that really gets to the conservative community, what's one of the things most precious in a person's life is their livelihood, right? Their ability to support their family. You may feel like, well, some of these country bumpkins, they don't know any better. They're yokels who just don't take the vaccine because they don't trust anybody. But an extraordinary number of doctors and nurses are willing to lose their job some of these people I know personally, and these are people that are trained in medical specialties. They understand the immunization process. Their hospital says, get the vaccine or you're gone. And they say, well, I guess I'm out of work. And this is in part leading us to a shortage of trained medical professionals at a time we need them. So these are not people that are uneducated or medically illiterate. They know, and they still are willing to lose their job. That's how strongly they feel. And last, and certainly not least, again, I'm completely in alignment with Hawk on this issue of a mandate. That's not America. I mean, Joe Biden says, I'm growing impatient. I don't care. It's not his business to tell me to inject something in my body. And of course, there's lots of ways that we all voluntarily cooperate for the good of society. I stop at stop signs. I do. I drive a little over the speed limit, but not during times of high traffic. There's lots of things that we do because it's good for society and we want people stopping at stoplights. That's pretty good. But no president has ever told me, get this injected into you, or I will possibly put financial penalties on you and your business and put you under. I'll destroy your livelihood. I'll destroy your family savings. Come on. I mean, this is not what America's about. And I think that when we look at other nations, if you study across Europe and you do comparatives, plenty of nations have rejected all of this. Denmark has an extremely low infection rate, yet they carry none of these mandates. And so why aren't we seeing, if this is problematic, you know, if you check that college and pro football, college football particularly, packed to the gills, has been for months and months. No major sources of huge breakout around that. So this leads to even more distrust because what we can see with our own eyes doesn't comport with this danger, this vaccine that once you take it, you can still get the disease, you can still transmit the disease, and now you have to take a booster. And Fauci said, well, you might have to take boosters the rest of your life. Again, this to me is it's absurd and obscene political theater, all designed to compress us to following what the government thinks we should do. The evidence, why not, as Hawk said, why not show us the data? And why not let other people analyze the data so it's peer reviewed? These things haven't happened. And when you look at all this and all these loopholes, if it's so good, why doesn't it apply to the post office? Why doesn't it apply to all these other groups that somehow are magically exempt? But if a small business with over 100 workers takes it, it doesn't enforce the mandate, they're going to be financially crushed by our government, our representative government. So,
and David, but what went into your sort of personal decision when you were thinking about whether or not you were going to get the vaccine, aside from the politics of it?
Yeah, well, I don't have a sort of a hyper strong objection. In fact, there was an event I was going to attend that I was able to finally do by Zoom, but I had a secondary reason why I couldn't get there. That would have been my impetus for considering taking it. But when I look at the people in my family and my circle out here in Western PA, which is where I live, it's kind of a rural area. I don't think most of my large extended family in my community are vaccinated. And I'm not trying to in any way downplay the seriousness of the disease, but I don't know anyone who's got it. And in my circumstance personally, I work from home. Unless one of my dogs picks it up and brings it in, my likelihood of transmission is very low. I suppose because of age and health, I might be considered in a at-risk position, but I don't feel that I'm in any more danger right now than looking at some of the possible side effects. And, you know, these are just the side effects that are popping up now. What about the things that might happen 2, 3, 5 years from now? For me right now, I'm kind of waiting it out. If I need to because of a work circumstance, I'm not so against it. I might, but as long as I don't have to, I'm probably not going to.
Gotcha. Well, Dr. Russell, I'm going to come to you next, and I definitely want to, get your response to some of what David and Hawk said. But first, as an ICU doctor at Columbia Presbyterian, you were on the front lines at the epicenter of the pandemic, particularly serving vulnerable populations in Washington Heights and the South Bronx. Can you tell us first what that experience has been like over the course of the past 18 months, from the initial wave in the spring of 2020 to this new phase, which some are calling a pandemic of the unvaccinated? And then maybe we can get a bit into what it's been like discussing the vaccine issue with patients.
So this, started, as we all know, last March, and New York was one of the very first early cities that had a lot of cases. It was started in the West Coast, I think, in the United States. And then New York is such a large hub for international travel and domestic travel that we got our first few cases at the end of March. And then it was exponential in number beyond anybody's expectations. It was horrific, actually. And at many points during it, we would look at each other and say, are we in America right now? And I hear where people are coming from when they have so much hesitancy about this. And I think a lot of it is a lot of our hospitals' response to the pandemic was because there was this need. And because New York is the most urban kind of environment in the United States with very dense housing, we have lots of multi-generational homes, people that live in very large apartment buildings. It is not possible to social distance. It is not possible to isolate. You have to be around people constantly to do life here. And because of that circumstance, it spread so rapidly to the point that our hospital was actually almost overwhelmed. And between March and April of last year, we shut down our operating rooms in order to make room for the ICU COVID patients. We stopped all elective procedures, which our hospital has never done in its history. And it's a huge tertiary referral center and a huge hospital. And to shut down operations because the patients needed hospital care was a very unusual circumstance. And the numbers kept rising, and it's a very large hospital, and our particular hospital had 117 beds, which is huge, which is a lot. Pandemic, we had to flex up to about 250 ICU beds. And I'm not talking regular inpatient floor beds. This is ICU. We had that many. We more than doubled our capacity and did it in a matter of days because the patients were coming in like tsunamis. And it was because we were not allowing family members in. We were just overwhelmed with COVID patients by themselves. Family members had to drop off their loved one to the emergency room, and they could not wait with them. They could not be with them. So we had lots of situations where people were in the ICU and they could not see their loved one. Their loved one could not see them. And what our hospital did was really remarkable. And I might get emotional about it because I'm so proud of what we did. When the city needed us, and when, like, the poor and the marginalized in our neighborhood needed us, our hospital said yes. And we never said no to a single patient that needed care, not one. And of course, we could care less about whether you were documented, whether you could pay, whether you had insurance. We treated everybody the same, and everybody got excellent care. And but it had a very dramatic effect. We turned our operating rooms into ICUs. And so these rooms are not designed to be critical care ICU rooms. These are operating rooms, and they don't have the equipment, they don't have the setup. And we had to cohort multiple patients into each operating room just because the need was so great. And I remember, several experiences where, these patients were just alone. They didn't have any family who could come in and be with them. And one in particular, she was dying, and one of the nurses had printed out for her, and handwritten, the very last text that she'd gotten from her niece. And so I called the niece, and who was her next of kin, and explained the situation to her, that there was actually nothing that we could do. And this was back in the beginning of the pandemic, where we didn't know what the treatments were. We were throwing everything at people and trying anything that was, reported to work in Italy, reported to work in Wuhan. And so we didn't know what was going to work and what was not going to work. And so I explained to the family that she was in refractory lung failure and was dying. And we had run out of options. And so the family said, okay, and elected to stop this life sustaining therapy when there was no chance for recovery. And I promised them that I would hold her hand, and I would read to her the last text that she got from her family, so that the last words that she heard, which I don't know that she could have heard at the end, but we just assume people can hear. And I read to her aloud the last text that she got before she died. And I stayed in there and held her hand. And there are dozens and dozens and dozens of stories like this, where the healthcare workers became people's families. And so we also utilized, physicians and nurses that weren't critical care physicians or nurses, and trained them up quickly. It was what they call battlefield promotions, where good enough. I'm going to put you in anyway. Sorry, my nose is running now. And we just flexed up to meet the need that was there. And the need was great. And the need was overwhelming. And it particularly hit the Black and Brown communities, the communities of the South Bronx, the communities of Washington Heights. And it was devastating. And then over the summer, it got a lot better. And the cases came down, and we were able to reopen and move patients out of the operating room ICUs into normal ICUs, and the census came down. And we were in the medical community, our hospital in particular, we were just waiting for the vaccine. We knew it was coming. We had faith that the cure was, we just needed to make it. And there was so much faith in humanity that somebody was just going to help solve this problem. And when the vaccine came out, we were running them to be the first in line to get it.
And can you talk a little bit about what it's been like since then? I presume the majority of patients who enter ICU care now for COVID are unvaccinated, correct?
That is correct. And I think we're also in a unique environment where a lot of New Yorkers are vaccinated. And so a lot more younger people who are unvaccinated, who are needing hospitalized in a way that we really didn't in the first wave. Getting COVID and not having severe symptoms enough to be hospitalized. And that is changing with the Delta variant. And we're seeing a lot more younger patients, and they are all unvaccinated. That's true. But because New Yorkers by and large are vaccinated or have had natural immunity from getting COVID the first time, it's not the same kind of crisis as there are in other pockets of the country that didn't experience this kind of intense wave the first time.
So you mentioned that a lot of your patients came from marginalized communities in the South Bronx and Washington Heights. I know Hawk was talking a little bit about some of the deep roots of distrust in those communities toward the medical establishment. Mm-hmm. What's your reaction when you hear that, and how do you think about that when you think about talking to patients who you're trying to protect and care for?
So I think most of us in healthcare recognize that the history of America is very complicated, and completely own the distrust that some communities have for us and acknowledge it. And what we try to do moving forward is to establish new trust in the here and now and in the present. And what made it even harder during the first wave was that family members were not allowed in. And so for some of them, this distrust was exacerbated by the fact that they just had to believe a disembodied voice on the phone telling them things about their loved one that they couldn't see and they couldn't experience for themselves. So we got a lot of reports from people within the community that, you know, our hospital was killing their loved ones, and all we could do was own that this was a reality and do our best. And as the hospital started to open up, we started to develop the trust again. And what we also did, at least in the operating room ICUs, where we redeployed some of our very high risk staff who could not take care of patients in person. We redeployed them to call family members every single day and give them an update, which doesn't always happen. And so we have a lot of people in our hospital. And so we tried to reestablish trust by giving like literally daily updates about what has gone up and down, if the trajectory was getting better, trajectory was getting worse, and full on acknowledged the distress that there is in some communities and addressed it with information, with transparency, honesty, and compassion.
Well, Hawk, I'd be curious to kind of get your reaction hearing from a doctor who's sort of her perspective on treating the community, because I guess what I'm hearing from both is that a lot of this just comes down to trust. And what information do you trust? Which sources of authority do you trust? And obviously, the consequences can be life and death. And so how do you think that doctors and the medical establishment and the government could build trust with the community? And how do you think the community could access that information that, as you mentioned, might take them over the burden of proof? You said, you know, I'll know it when I see it, but what do you think that feels like, even if you don't know it? And you're on mute.
If the medical community and the government cared, right, and pharma really cared, then, you know, treatments for, you know, cancer, medications, all of that stuff would be free for the American public, right? If people really cared so much, then all of these things would be free. I just want to say thank you to Dr. Russell, because it sounds like you all went above and beyond, and those stories really touched my heart. I'm drawn back to the beginning of the quarantine, the lockdown, and we noticed first, right? We being the activist community and people in the streets noticed first, either through our timelines or through news stories, that Black communities were being hit the worst by COVID, right? So you're looking at you know, your Facebook and your Instagram, you're seeing that people you know, but then their relatives are dying. The government here in New York had all the resources where the rich people were, right? And I know that's easy to say, like, come on, Hawk, that's an easy accusation to make. But it wasn't until we petitioned and raised a little hay with Governor Cuomo's office that they stood up and said, hey, we're reading the data, and it appears as though the hardest hit communities will be the Black and brown communities. So we're going to rush to get them resources. They didn't care in the beginning. Like we're not talking about just slavery. Like, oh, Black people are mad because of slavery. No, we're talking about things that are still happening today and yesterday. You understand what I'm saying? Like this whole thing with COVID is less than a year old. Like, they have been abusing our trust within the last year. So if we're talking about building trust, then we need certain levels of accountability. You know, we need transparency. We need the government to stop lying to us and manipulating the people. Like I said, my mother is unvaccinated, and I kind of nudged her to get the vaccine, right? My son is nonverbal autistic and overweight, right? He's nonverbal autistic. He's 18. He's overweight. He ticks a lot of bad boxes. so I'm going to get him vaccinated. But me personally, like, I'm not going to put that crap in I don't trust it. I really, really seriously do not trust it, especially the way that they're forcing it on us. Johnson & Johnson was the one that they gave out here in the Bronx like candy. And that was like the worst one. That's like the one that they gave to the black people was like the ghetto. Dave Chappelle was talking about it, right? It was like, he said that getting a Johnson & Johnson vaccine was the most niggerish thing he's done in years, right? That's what they give to all the people and all the poor black and brown people. And that's the worst one, right? We face recalls. Like, this thing is not good for us. It could be good, and it's helping people. But what I'm saying is we have so much reason to have pause, and that's why I won't put it in my body,
Can I ask you, did you say that you nudged your mom to get the vaccine?
Yeah.
So did she end up getting it?
No, but
Okay.
We went to her doctor. We grew up in the South Bronx. We haven't left our community, but we don't get health care here. We don't get food from here because they send the worst of everything to the Bronx, right? So my mother's doctor is New York Hospital, I think, down on the Upper East Side, whatever. And he's like, yeah, and we were arguing. This was around the time my New York Times article came out, and me and her physician were going back and forth. He was like, no, I think she should get it, and she should get the Johnson & Johnson. Of course you do, Doc. This is, I don't know what memo went out that said this is what all black people have to get. But yeah, it's just, man, it's sad. Like, this thing might actually help us. It might actually help us, but the pond is so polluted that we just refuse to drink the water. Like, it's ridiculous.
I was a volunteer for several shifts to give out vaccines at the Armory, which is this large like indoor gym in the Washington Heights. And
I'm right across the bridge. I'm by Yankee Stadium. I know exactly what you're talking about. Yeah.
And so I did 3 shifts there, and it was one of the funnest things that I have done in 2021 because everybody there was so happy. Some of these old people had not been outside of their home, and we're talking January, February this year. They hadn't been outside of their home since like March. And they were so scared and so happy to come and get their vaccine. And it was interesting. We gave out the Pfizer vaccine, partly because that's our hospital, it requires a really big freezer. You have to store it correctly. It's only good after it's been thawed for so long, et cetera. So we gave out the Pfizer vaccine. And I gave it to a lot of Black people.
Awesome. But the numbers dictate that only, I believe, 27% of Black people between the ages of 18 and 44, right, are vaccinated. So we're talking 3/4 of young Black New York, according to the New York Times, are unvaccinated. The revolutionary people, the people who are out here changing the world, the people who had everybody talking about racism and all these different constructs and systemic racism, those people that have moved us forward into the future don't want any parts of the vaccine. And, older Black people are a lot easier to convince of things than young Black people. Like, they thought Biden was actually good, the older Black people. You like that, David? No, but but this is what it is. We are young and revolutionary in thought, and we don't trust this establishment.
Well, David, how do you react to this? Because I'm hearing similar things in terms of distrusting government and a sense that the information we're receiving is not necessarily the information we can trust, and therefore I'm not gonna, take my chances with something I don't trust.
Well, I think to start, again, a great honor to Dr. Russell for her commitment. And she, like many, many other doctors, put in long hours under horrific circumstances, often without the appropriate, masks and face shields and so forth that should have been mandated, but that we couldn't get. And so with COVID itself as a disease, no one questions the severity and the tragedy of the way it hit. But I think Hawk used exactly the right language. The accountability, transparency, stop manipulating. You know, the American way in the best of it has always been get the data out, let the false stuff be disproven, let the truth emerge so that we can embrace it. And it's the transparency of that process that allows us. Now, within my professional work, I've worked with 3 companies involved in drug research and drug prediction, trying to predict side effects. One company very specifically has an extremely unique methodology using custom engineered liver cells that they can early on in drug development try to anticipate. But what I learned about that is that there's only a certain number of things you can figure out before, and some of them take a long time to develop, the way the body will react over time. And so all the other vaccines that we routinely trust, our flu vaccines, the polio vaccines, none of these were put together in a year. And I will tell you that even those that are supporters of Trump, a lot of us, even when he was in office, were very skeptical of Project Warp Speed. Like, well, wait a second. Is this a good idea? Can this be rushed? And of course, our current president and vice president went on TV and they said, that vaccine, I'll never take it. Of course, now that they're in office, they have a slightly different feeling, but they not only say you should take it, they say you must take it. And if you don't, we're going to punish you. And this, of course, simply fuels this distrust that's ongoing. I would hope that in the coming years, we might later find that, in fact, the vaccine had great effectiveness and it did not have long-term negative side effects. But if we find out it did, and I also think to Dr. Russell's point, it's almost like this is the first time we've felt that we had to rush all the production, not share the data, suppress information about lots of other things. They may not be cures or vaccines, but they have a positive effect. Other doctors from other nations have said, well, there are other things you can take. We push that aside. But, the real question is, if we find out there is something long-term that's somewhat irreversible once the shot's in you, what do we do then? And also, what about natural immunity? I mean, there's a little bit of a bit of, let's say call it graveyard humor. A friend of mine said, I've got a joke about COVID, but there's a 99.696% chance you won't get it. So there are other communities and other nations that have said, yes, it's a terrible disease, but it only affects disproportionately for fatalities extremely at-risk communities, which other diseases do too. There's lots of diseases that if you're older and obese and you have all kinds of other health conditions, you're more likely to die, even from the plain old flu. And yet we want to take a community, the vast majority, of young people till age late 50s could quite reasonably, under current statistics, not only survive a COVID engagement, but come out then with natural immunity, the way that our bodies are designed. Why do we want to be taking, I heard Johnson & Johnson's lobbying for a 5 to 11-year-old vaccine to be mandated. Why do we want to be sticking needles of something with so little long-term research into people that will have to deal with consequences for 65 to 70 years? So that's where I stand. I hope that the long-term data shows that it was effective, but I'd rather wait a long time to see what it shows, which is normally what drug discovery does. They would have the vaccine, they would take long-term studies, and then they would say, we can show its effectiveness, you should want to take it, rather than it was ramrodded through, but you're going to take it or else. This cannot do anything but promote distrust and suspicion.
Dr. Russell, do you want to respond to some of those points of skepticism that David and Hawk raised? Because I imagine you've also heard some of it from patients and conversations that you've had elsewhere, I imagine.
Yes, sure. And again, I'm not trying to convince anybody to take it. These are just my own views. I think that, well, first, yes, it was done very quickly. And instead of doing things in sequence, they did them in parallel and started producing it before it had been approved yet. And I can recognize where there is some hesitation in approaching something like that. I also think it's unique. This problem is unique to our time, in that in the 1950s, when the polio vaccine came out, you didn't see any parents asking any questions. And I think this is, again, a different time when there was a lot of trust in government 60, 70 years ago. You just saw parents lining their kids up to get them vaccinated against polio because they saw what childhood polio did. And additionally, let me think. I had several thoughts and I should have been writing them down. Sorry, it's the 30-hour work shift that's fogging my brain. I agree that our vaccine side effects are likely underreported because America has a passive vaccine side effect reporting system. You have to sort of disclose whether you've had a reaction. A lot of people I know had reactions to the vaccine. They were minor. They were flu-like symptoms, very similar to what you get when you get a flu shot. You'll have a day and a half of fever. Sometimes people had severe symptoms for 7-10 days. And, the number of people who had those kind of symptoms is really underreported. I think what gives me a little bit of hope is that when the blood clots were discovered, which was a very rare but very devastating complication in certain older women, or women, I should say, where you developed these large blood clots that would have devastating consequences. The giving out the vaccine, that was the Johnson & Johnson one, paused until they could reassess the safety. And I think anytime that you give one drug to 1 billion people, you're going to see things that happen in such a large population. And you have to do a lot of research. And I think David's point is correct. More long-term studies assessing whether those side effects happen and are part of sort of the natural emergence of things that would happen in a general population versus something directly related to the vaccine, that's a fair point. I have definitely taken care of a young man who developed severe heart failure 5 weeks after the vaccine. And there is definitely a signal. It's rare, but it definitely a signal that young men can develop myocarditis, an inflammation of the heart muscle that can be very significant. So I agree with you that the United States is not reporting vaccine side effects to the degree that some other countries who have a much more active system and also a smaller population, to be honest. If you're comparing the United States to European countries, everything is different on every level. Israel has very robust health services and data capture, but they're a pretty small nation. You could do that if we were the size of Texas. So I think David's points are fair. And I think everybody makes a risk-benefit judgment call, a risk-benefit analysis for themselves. I think, David, as he suggested, or as he stated, isn't around a lot of people. You're able to work from home. My worry is about those people who don't have the luxury of working from home. It's only, relatively affluent, white collar workers that can work from home. If this pandemic had happened in 1998, I was listening to something that Dr. Vinay Prasad from UCSF was saying, and he made a really interesting point that if this pandemic had happened in the 90s, we would have had a completely different response to it, which is we would not have had the actual bandwidth to work from home. Nobody would have been able to work from home for a year. Who could do that? We would have had to have made compromises and found a way through that didn't, put our economy and grind it to a halt. And I think we have a lot of information now. There's distrust for mainstream media. There is, these third rail media companies coming up with their own information. People are getting censored on YouTube and Facebook, and it seems to be a certain political stripe of opinion gets censored on some of these major platforms. So I acknowledge all of the all of the points.
Mm.
And
Thank
yet,
you.
I still think for the majority of adults who have pre-existing conditions, including obesity and smoking and asthma and other things, that the benefit of getting a vaccine that will reduce their risk of long-term COVID, will reduce the severity of symptoms and reduce hospitalizations and deaths, likely outweighs the risks of the vaccine. But to David's point, it's only a year old. It's a lot we don't know.
David, yeah, I see your hand is up.
I'd just like very briefly to say that that's a really fascinating point about what would have happened in the 90s. Certainly the work that I do professionally couldn't have been done without face-to-face then. But I suspect that we would have not also had the time to say, everybody just live off your savings for a year. We would have had a much more rapid process of herd immunity, and might have ultimately concluded that by the time the vaccine got here, it was not, absolutely required. But I also think there's another point about our modern times. Given the nature, I think, of media in general and social media, everything seems to me has to be a catastrophe. That we're all going to be frozen in 3 years, or the seas are going to rise and drown us in 5 years. Everything that gets promoted is kind of a end of world episode that creates anxiety and tension and frustration. But I think for folks in my community and in Hawk's community who already have kind of an inbuilt distrust for the government forcing things and telling us what to do, that kind of sensationalizing of this thing made it even worse. We were even less inclined to believe what was going on. But that seems to be the nature of the world we live in today.
I just have one comment about vaccine mandates. It sounds oppressive, but there is a history of vaccine mandates. School children are required, unless you have religious exemptions, to be vaccinated against measles, mumps, rubella. So, and in healthcare, at least. Go ahead.
There's no religious exemptions for this COVID mandate. Like, people are getting rejected. Like, they just changed all the rules. Like, this is completely unfair. I just like to speak from a very commonsensical perspective. It's like our heroes last year, and now these people are going to be unemployed. I had a layover in Indianapolis, and this dude's wife was a nurse for 27 years. Now they have to reimagine their life, their entire life, because she's being forced to take the jab and put the shot in her body. Like, it's so hypocritical, right? Because I try to look at things as broadly and as evenly as possible. You have the Democrats, my body, my choice. Nobody should tell a woman or anyone else what to do with their body. Really? But now they're all in favor of us putting this vaccine in our body. You look at the Republicans who are anti-abortion, who want to force women to have babies, and now they're saying the government can't tell me what to do with my body. I represent the interests of Black people and oppressed people. I just can't deal with either one of these parties, and I hate the damage that they do to the public. Like, it's all mind games. It's all hypocrisy. Donald Trump coined the phrase fake news. I think that was the best thing to come out of his presidency, right? Because the news is all bought, paid for, and manipulated. And now you're looking at social media. Like, you can't even voice your opinion on social media anymore. Who the hell is Mark Zuckerberg to regulate my speech, right? And these are platforms that everybody's on. It's just it's terrible. It's like there's no Gestapo. Well, I mean, they do investigate me, but there's no Gestapo that'll come and rip you out of your house. But they'll find a way to shut your life down. if you speak out against this vaccine. Like, a lot of people make their money on social media. A lot of people, that's how they get their messages out. They're literally silencing people through social media. I just can't believe that more people don't see things the way that we do right now. You know, and just to go back, to bring it back home, all of these doctors and nurses were heroes and essential workers last year. Now it's like, if you don't take the vaccine, who cares? Who cares about you or your family? It's look at the teachers. Look at the teachers who had to put up with these knucklehead kids during long distance learning, you know, and now they're getting fired. Like, this world is just a foul place.
But Hawk, what do you think about the argument that we already mandate vaccines for children? Is that primarily the difference that those vaccines have been around longer, and so there's more trust in them? Or what do you see as the difference?
I always think about, you know, the special court for your for lawsuits against pharma companies. Like, it's so hard to sue companies because of vaccines, and also the religious exemption. Right? Like, this COVID vaccine is impervious to the religious exemption. Like, on its face, like, people say separation of God and country. Come on, we know that this is a Christian country. Let's get past the BS. Okay. Now, if there's nothing you should be able to hide behind in America, you should be able to hide behind God, right? I mean, you can't say that this goes against my beliefs. Like, some people feel like it's the mark of the beast, right? Like, some people like just don't want to take this vaccine, and there's no way that they can get out of it. They'll lose their life. Now, who's to say that these tests are ineffective? If you wanted to require people to get these quick tests, you get results in 15 minutes to an hour and 15 minutes. Like, why can't we just get tested every 3 days? Like, why take that off the table? Why take that off the table? It's horrible.
I think it's a really good point, because lots of European countries where the testing is, especially in like Great Britain, there's people test themselves all the time because the testing is so readily available and cheap. It is an interesting point. And, you know, as far as kid vaccines go, I've got 3 children, and I actually got COVID a month ago. Fun fact, I got it from one of my children who got it from another child. And I had a breakthrough infection, and I got vaccinated in January. And my symptoms were pretty mild, and I was only sick for about a day and a half, and then I had to quarantine for 10 days. But my oldest kid got it also. He was 11, and he turned 12 during his quarantine, and he had COVID, so he had natural immunity. In order for him to do anything in society, he has to show that he's been vaccinated if he's over 12. And against some very deep reservations, I got him vaccinated, but I was very conflicted and actually a little bit upset that natural immunity doesn't count like it does in other countries. In France, natural immunity counts. You can show that you've been vaccinated, or you can show that you have antibodies, and either one of them are equally valid. And I think it's interesting that the United States doesn't do that.
Well, I think that's an excellent point. And I have a very close friend who's doing some studies in Denmark and traveling all around Europe, you know, because it's so easy to get around. And, you know, she's advised the same thing, that natural immunity counts, that if you've got it. But I mean, let's be at our most cynical worst here. Why don't we do it in the US? Because then the people that sell the vaccines wouldn't sell millions of more vaccines if it's mandated for everybody. If we took all the people that had COVID and their bodies work the way they are designed to work, and they have natural immunity, what purpose is the jab? But what purpose? Well, there's obviously a purpose. The purpose is that the people that made the vaccines, and you know, I understand the reality of drug discovery, having worked with companies in it. A lot more fail than succeed. And so perhaps the reason we pay a lot for certain drugs is that we're really paying the price of all those failures to get the one that works. Fair enough. But yet, to mandate an injection for a person with natural immunity is completely nonsensical. It goes against all rationality, unless it's the rationality of the mandate forces all that payment for those drugs into the hands of the companies that make them. And I think, again, speaking for the community I work in, that just makes us all the more suspicious. And not even an exemption for religious basis or for natural immunity gets you out of this jab.
Well, I think we're running out of time here, and it looks like we may have lost Hawk. But I guess my final question, maybe just take up to a minute or two to reflect on what you learned from this conversation and sort of, how you're feeling about it going forward. So I'll start with you, David.
Well, I mean, I learned, of course, that the commitment of medical professionals to treat COVID, to deal with the same concerns and apprehensions that everyone has about the vaccine and the efficacy and whether it's for them or for their children. This is not something that's limited to the Black community or the Trump community. That it's something that rationally folks all the way around are having to struggle with. And we're trying to struggle with it to make good decisions. We want to do best by ourselves and our family. It's not just sort of a government says it, therefore we won't do it. Not at all. If there were simply more trusting of us to see data and not suppress it, might be convincing a lot more people. And then last but not least, as a very pro-Trump guy, I can't wait to get off the podcast and call my Trump friends to say I had an hour-long conversation that included Hawk Newsome and we agreed on everything. The odds of that, I mean, that's got to be highly unusual.
Very true. Dr. Russell, take us home. How are you feeling about this conversation?
I was actually quite gratified to find the commonalities between two polar opposite political groups. And it goes to show that people are really complicated and people's reactions to this vaccine to this pandemic are very complicated, and they're emotional and they're social. And I hope that in some ways this conversation opens people's eyes up to other perspectives, and we actually have more in common than we have differences. So that was actually really lovely to be a part of. Thank you for having me.
Yes, I think that's a great note to end on. My thanks to both of you, my thanks to Hawk, and my thanks to all of our listeners. You should like and subscribe and write us at media@braverangels.org with any feedback, questions, comments, criticisms, compliments. We take it all, and we will see you next time.